안녕하세요. Hello, I'm Dr. Erin Holve, Chief Research Infrastructure Officer for the Patient-Centered Outcomes Research Institute, or PCORI. I'm very pleased to join all of you today for your Patient-Centered Research Program Conference. In this presentation, I will provide information about PCORI and the work we're doing to advance patient-centered comparative clinical effectiveness research, including our innovative work to engage patients and other stakeholders in research, our work building new data and people power to support the infrastructure with our PCORNet Clinical Research Network, and I will share our achievements through our portfolio responding to COVID-19. Throughout the talk, I will provide information on PCORI's future directions for funding, including the topic themes that will be the focus of upcoming funding announcements. Finally, I will share a set of on-demand resources that are freely available to support the patient-centered research community, which I hope you will find useful. Let's begin with, who is PCORI and what does PCORI do? PCORI is an independent, nonprofit research organization that is based in the United States. PCORI seeks to empower patients and others with actionable information about their health and healthcare choices. We issue PCORI funding announcements several times each year to fund patient-centered comparative clinical effectiveness research, or CER, which compares two or more medical treatments, services, or healthcare practices to help patients and other stakeholders make better informed decisions. The vast majority of the research PCORI funds is for CER projects, but we also fund awards to promote engagement in research dissemination and implementation, methodology research, and the development of research infrastructure, including PCORNet, the National Patient-Centered Clinical Research Network. PCORI's vision is to ensure patients and the public have the information they can use to make healthcare decisions that reflect their desired health outcomes. We do this by helping people to access evidence-based information that comes from research guided by patients, caregivers, and the broader healthcare community. In 2010, the United States Congress authorized the establishment of the Patient-Centered Outcomes Research Institute, and in late 2019, Congress reauthorized PCORI funding for another 10 years. As a research funder, convener, and employer, PCORI is dedicated to advancing and accelerating diversity, equity, and inclusion in all of our work. We remain committed to increasing the diversity of PCORI's community of stakeholders, including the pool of applicants, reviewers, awardees, and research participants, and to promoting inclusive PCORI convenings, such as our annual meeting. Our commitment also includes redoubling our efforts to identify and to address any racism or unconscious bias in our funding process, and seeking ways to further advance inclusivity and diversity among the stakeholder communities that shape our work and participate in our research studies. So what makes us unique? Traditional healthcare research doesn't always answer the questions patients are facing. Too often, patients and those who care for them lack the information necessary to make informed healthcare decisions, which is why research funded by PCORI concentrates on healthcare decisions and challenges confronting families every day, including those related to cancer, diabetes, maternal mortality, opioid addiction, mental health, and equitable access to care, among many others. At the core of patient-centered CER and our organization is the understanding that empowering patients and other stakeholders with better information means better outcomes, better overall health, and a system that is more efficient and affordable. Patients deserve to know whether or not some approaches work better than others for certain populations, and caregivers, clinicians, and all of our stakeholders benefit from better information about care options. PCORI-funded research provides real-world answers to help all patients become more empowered decision makers. Key features of our research and research-related projects include engaging patients and other stakeholders throughout the research process, comparing at least two medical treatments, services, or health practices, each of which must have evidence of efficacy or that treatment is in widespread use. Focusing on answering questions that are important to patients and those who care for them, and aiming to produce evidence that can be applied in real-world settings. PCORI's 5 national priorities for health are foundational to our work. These are ambitious, long-term goals that will guide PCORI's funding of patient-centered CER and other initiatives related to engagement, dissemination, implementation, and research infrastructure. Briefly, the adopted national priorities for health are: 1, to increase evidence for existing interventions and emerging innovations in health; 2, to enhance infrastructure to accelerate patient-centered outcomes research; 3, to advance the science of dissemination, implementation, and health communication; 4, to achieve health equity; and 5, to accelerate progress toward an integrated learning health system. They are designed to work together in an integrated and synergistic way, revolving around the core goal of patient-centered health, and reinforced by the two cross-cutting themes of health equity and stakeholder engagement. They are also focused intentionally on outcomes through action verbs like advance and achieve, which reflect the influences on health that are beyond the purely clinical realm. PCORI has embraced a holistic approach to generating and promoting the use of evidence designed to enable a more patient-centered system of health. This includes 4 essential elements. The first is funding comparative clinical effectiveness research. The second is stakeholder engagement. The third is dissemination and implementation of PCORI-funded research results. And number 4, investing in the nation's health research infrastructure, including the methods of CER, development of the patient-centered outcomes research workforce, and support for data and technology innovations that can make research more efficient. Pursuing this holistic approach to generating and promoting truly patient-centered evidence also means taking a broader view of all of the influences on a person's health, such as social determinants of health that are present where people live, learn, work, and play. And we know that we cannot do this work alone. This approach means strengthening existing partnerships and building new ones. For example, with national and community organizations that work in sectors such as housing or education. The National Priorities for Health form the basis for PCORI's research agenda, which consists of 6 focus areas. Woven through these 6 focus areas is an emphasis on emerging innovations in health, data and partnerships, advancing diversity, equity, and inclusion, and implementation. The National Priorities for Health and the research agenda have guided the selection of more specific funding topics that I will describe in the next few slides. Turning to our research portfolio, I'd like to begin by speaking about the heart of PCORI's work, funding patient-centered CER. Over the past year, rich insights from our stakeholders have deeply informed this work. As depicted in the process on this slide, the stakeholder input, along with our evidence synthesis and research agendas developed from PCORI engagement awards and funded convenings, was carefully considered and distilled into a set of 8 broad topic themes, which were approved by PCORI's Board of Governors. The result of this process was the identification of 12 topic themes that will inform focused funding opportunities over PCORI's next several funding cycles. As discussed in the previous slide, 8 of the broad topic themes were approved by PCORI's Board of Governors in July 2022 and speak to health issues facing large numbers of people in the United States. The themes also address urgent topics such as violence and trauma, substance use, and mental and behavioral health, as well as widespread conditions including cardiovascular disease, pain management, and sleep health. These themes joined 4 that were ongoing: preventing maternal morbidity and mortality, improving outcomes for people with intellectual and developmental disabilities, addressing COVID-19, and addressing rare diseases. Several of these topics, including cardiovascular health, align with research areas funded by PACEN as well. Since its authorization by Congress in 2010, PCORI has awarded nearly $4 billion to fund more than 2,400 research and research-related projects. PCORI-funded research results receive attention in highly competitive peer-reviewed journals, as well as other publications, including systematic reviews, clinical guidelines, policy documents, and even receive multiple citations in the up-to-date point-of-care decision tool. As I have shared, the heart of PCORI's work is funding patient-centered CER, which includes studying the risks and benefits of 2 or more approaches to healthcare. All of these studies must compare interventions that already have robust evidence of efficacy and are in current use in practice. If efficacy is not well established, then widespread use must be documented. We also fund projects aimed at bringing more patients, caregivers, clinicians, and other healthcare stakeholders into the research process. Infrastructure funding to advance the conduct of patient-centered CER, and dissemination and implementation awards to facilitate the uptake of research findings in practice settings. This slide will give you a quick view of our CER 2023 funding announcements. As you can see, we have 3 funding cycles each year. The opportunities range from our methods projects, which may request up to $750,000 in direct costs, to our broad pragmatic studies, which may include budgets up to $10 million, to our phased large awards, which are innovative studies with some risks that may request up to $25 million over a phased award up to 5 years. Topical funding opportunities will relate to the topic themes described previously and will be released later this year. I encourage you to visit PCORI.org to review the detailed announcements and learn more. Let's talk for a moment about how PCORI funds support our efforts to build patient engagement. In PCORI-funded research, patients and other healthcare stakeholders are equitable partners as opposed to research subjects. PCORI believes engagement of non-traditional stakeholders, from topic selection through the design and conduct of research, as well as to dissemination of results, can lead to greater use of healthcare research results by patients and the broader healthcare community. This is central to our mission to fund useful CER that will help patients and those who care for them make better informed healthcare decisions. Here you can see information about the different competitive engagement funding opportunities. Most of our awards fall under the topic of capacity building. They provide an opportunity for organizations and community groups to build capacity and skills for patient-centered CER. All of these awards must demonstrate meaningful stakeholder engagement throughout the project. These projects typically range in funding from $100,000 to $250,000 for a 2-year program. As many of you know, historically there has been a years-long divide between the completion of research studies and the uptake of findings in practice, where they can have an impact on healthcare and on patients' lives. An important part of PCORI's mission is the commitment to helping to cross this divide so that findings from the research we fund are available to support patients, caregivers, clinicians, and others in making healthcare decisions, and that they're available in a much more timely way. In PCORI's Dissemination and Implementation Program, we offer funding opportunities for implementation projects to promote the uptake of evidence. PCORI's implementation projects are not research, but are demonstration projects designed to build broader use of evidence from PCORI's funded research in the context of a larger body of evidence. For example, they often focus on integrating interventions into clinical workflows, adapting them to reflect the context of local settings, and working with stakeholders who can support practice change within and beyond the project to support long-term change. So here is a summary of our implementation funding opportunities. Most of our awards are in the range of $1.5 to $2.5 million and are about 3 years in length. Let's turn for a moment to talk about the infrastructure needed to transform the research enterprise. PCORI's Infrastructure and Innovation Division, which I lead, promotes synergies between the data, technology, methods, and people power needed to transform health research and advance the next generation of patient-centered CER. PCORNet is a flagship program funded by PCORI and our infrastructure group. PCORNet is a national resource established to address an urgent need, the capacity to conduct patient-centered outcomes research faster, more efficiently, and by leveraging the power of health data, reusable research infrastructure, and patient partnerships. PCORNet can be used to conduct both high-quality observational studies as well as pragmatic trials. Overall, PCORNet infrastructure is well suited for the conduct of a variety of studies, including real-world evidence studies, pragmatic clinical trials, population health research, methodological research, health systems research, and studies on how best to engage patients in research. In the traditional research environment, researchers, patients, clinicians, data, and health systems each operate in their own silos. In PCORNet, they unite as a network of networks. PCORNet is an integrated partnership of 8 large clinical research networks around the United States, as well as a coordinating center. PCORNet represents a diverse set of patients and institutions ranging from academic medical centers to local community health clinics. In this way, PCORNet breaks down the silos to bring patients and health system partners together with high-quality data. With electronic health record data from more than 13,000 clinical sites of care and more than 30 million patients available for clinical trial recruitment, PCORNet is comparable to the nation demographically. PCORNet partners continue to work together to continuously improve resources and tools that advance health research using the network so that each study is able to improve upon the last. Already, more than 30 patient-centered national-scale studies using PCORNet have been conducted by the network, with well over 100 studies that have been conducting using data that we say is powered by PCORNet. PCORNet is open to all interested researchers. We encourage investigators, funders, patient groups, and health systems to explore PCORNet and consider it as a possible platform for future studies assessing the health of the United States population. As PCORNet matures as a network, an increasing number of high-impact studies are using the PCORNet data infrastructure to conduct what we call PCORNet studies. Some of these are funded by PCORI and others are funded by our federal partners using the network. You may have heard of some of the major contributions PCORNet has made to COVID research in the last year, such as the U.S. Centers for Disease Control supported work to assess cardiac complications following COVID infection and mRNA vaccination, which was published in the Morbidity and Mortality Weekly Review. In addition, a recent paper in Nature Medicine used PCORNet to identify a set of subphenotypes for long COVID. Adaptable, the aspirin study, and the work PCORNet partners conducted to compare 3 types of weight loss surgery are among other notable examples of hundreds of published research papers that are using PCORNet. As just discussed, PCORNet partners were actively involved in addressing COVID-19. Through several funding opportunities, PCORI has funded, in fact, more than $40 million in targeted research awards for COVID-19 and another $35 million in enhancement funding for existing awardees, more than 120 projects in total. PCORI remains committed to funding studies that address patient-centered CER of interventions to address COVID-19. Both PCORI-funded research and federal funders have used PCORNet, as just discussed, to address some of the critical questions to understanding the most effective therapies and approaches to improve outcomes for individuals with COVID-19 and post-acute sequelae to COVID. As one example, the Accelerating COVID-19 Therapeutic Interventions and Vaccines, or ACTIVE program, was coordinated by the Foundation for the National Institutes of Health. ACTIVE brings the NIH together with other agencies from the U.S. Department of Health and Human Services and other partners such as PCORI to develop a coordinated strategic research approach to prioritizing and speeding development of the most promising treatments and vaccines. PCORNet partners have been a strong component of this effort since the breadth of PCORNet data allows COVID-related knowledge gaps to be rapidly addressed. Using the platform, ivermectin, fluvoxamine, and fluticasone have all been evaluated as potential COVID-19 therapies in ACTIVE-6, with results published in top-tier journals. PCORNet has also been used to understand treatment patterns for COVID-19. In a study funded by the U.S. Centers for Disease Control using PCORNet, investigators highlighted the lower use of monoclonal and antibody treatment among Black, Asian, and Hispanic patients who had tested positive for COVID-19 relative to white and non-Hispanic patients. This study is a useful example of a finding which provided actionable evidence to adjust outreach strategies for COVID-19. Turning to PCORI-funded studies, in another example, Delgado and colleagues at the University of Pennsylvania School of Medicine used a text messaging system called COVID Watch to monitor COVID symptoms remotely for one group of patients and compared those results to patients who received usual care. Patients under COVID Watch were more likely to seek medical care, they presented to the emergency department sooner and in better condition, and were less likely to require the use of a ventilator in the hospital. Enrollment in COVID Watch was also associated with lower mortality. Patients who were enrolled in the COVID Watch system were 68% less likely to die. The three examples I have just shared illustrate the range of therapeutic modalities and interventions that PCORI resources and projects are addressing. In addition, in 2021, PCORI launched a special cycle of engagement awards on COVID-19. In one project, co-learning and collaboration around COVID-19, connecting researchers and underserved patients, the research team worked with a diverse cohort of underserved patients who draw from their own lived experience with COVID-19 to help build a learning community of patients, caregivers, and researchers. This COVID cohort will be prepared to advise and partner on research projects and facilitate connections with the research community for specific patient-centered outcomes research and comparative clinical effectiveness research projects. Partnerships such as these are the heart of our engagement work. Now I would like to share some of the free and on-demand resources that PCORI offers to the research community. We know that people who are new to health research have many questions, such as what is patient-centered outcomes research? How does the research process work? How can I be an effective partner on a research study? And PCORI's free and on-demand training package, Research Fundamentals, was designed to answer these questions and more. Research Fundamentals is designed to help you and your research partners to understand the language and the logic of the research process in an engaging and easy-to-grasp way. Another resource, Building Effective Multi-Stakeholder Research Teams, offers resources created to support all members of research teams in working together. Each section includes evidence-based information and resources for team members to learn new concepts and skills. This slide includes links to both resources, and we encourage you to visit PCORI's website to learn more. Next slide, please. In addition, PCORI's evidence updates provide short summaries distilling main findings from PCORI-funded studies or systematic reviews. As you can see in these examples, we invite stakeholder organizations to work with us on dissemination. In this case, we've worked closely with the National Association for Continence and Healthy Women. These patient and professional organizations help us with the framing of findings and with the reaching targeted audiences. PCORI's Horizon Scanning Database is an interactive system that highlights potential disruptions in healthcare over the next 3 years. It offers healthcare decision makers findings about advancement in 6 key areas of interest: Alzheimer's disease and other dementias, cancer, cardiovascular diseases, COVID-19, mental health and behavioral health, and rare diseases. This database can be used by patients, care partners, researchers, and others to track advancements in care options. If you're interested in staying in touch regarding PCORI-funded research and opportunities, I encourage you to sign up for our weekly email and newsletter. While our funding announcements are designed for U.S.-based researchers, all webinars and resources are available to our international colleagues. Finally, please consider joining us for our highly popular annual meeting, which is open to all as a hybrid event. Participating in the PCORI annual meeting provides a great opportunity to hear more about the work PCORI is engaged in to advance our mission. It also provides an excellent set of information about innovative patient-centered CER methods and findings. Thank you again for the opportunity to present our work at PCORI to the PACEN community.